Today, on the occasion of International Women's Day, I wanted to honour and pay tribute to the central role that women play in palliative care. Women have been the pioneers of palliative care both internationally and in Australia. Jeanne Garnier, a French widow and bereaved mother, founded the Home for the Dying in France in 1842. This is one of our first known hospices. Frances Davidson founded the first Home for the Dying in Britain in 1885, and Dame Cicely Saunders changed the way the medical profession and society viewed palliative care and care for the dying when she incorporated both physical, psychosocial, social, spiritual and practical needs into a multidisciplinary model that we still use today. This engaged people to work together to ensure that an individual's needs were met. It was women in the United States and Ireland that founded the first hospices in these countries. Swiss-born American physician and psychiatrist Elizabeth Kubler-Ross developed and pioneered palliative care in the United States. She prepared patients and their families to cope with life-limiting illness and mortality with dignity. She prioritised autonomy and individualism and the wishes of the dying. Our staff do this every day. The 5 stages of grief that were written about in her books were things that I learnt in my undergraduate training as a nurse over 30 years ago. She explained the phases of grief: denial, anger, bargaining, depression and acceptance. And our counselling team, our volunteers and our staff witness these processes in action and support individuals to move through the processes and find peace with their grief. Women bring us into the world, and they're also there at the bedside or with us as we die. A woman gave birth to every single one of us, and at end of life, the odds are that a woman will be there when you take your last breath. 75% of Australians will need palliative care. We won't have a sudden death or die in an accident. We will die of a life-limiting illness, and most of us will live to our ripe old age and enjoy our families, our friends and our community until then. Heart disease, cancer, dementia, Alzheimer's disease, pulmonary disease are the biggest killers in Australia and the leading causes of death. Women are leaders in healthcare and in the caring professions, with research indicating that 75% of caregivers are women. We value their amazing leadership, their skills, the support that they provide to each other and to individuals each and every day. This helps individuals to live well. Our focus is always on doing better for others. So I'd like to pay tribute to the wonderful women at Palliative Care South East, our staff, our volunteers and our carers. Today we celebrate these amazing women in palliative care and in our community and beyond. Our team at Palliative Care includes extraordinary women who support the care of individuals with a life-limiting illness and empower them to shine. I'd like to just highlight our co-founder, Dr. Ruth Redpath, whose vision almost 50 years ago brought home-based palliative care services to the city of Greater Dandenong. Our board chair and leader, Emeritus Professor Margaret O'Connor, and the many members of our amazing team of professionals have been inspiring others in our service for so many years. Melbourne South East is better off because a palliative care service such as South East Palliative Care exists. We will be there when someone needs our help. Women make up the majority of doctors, nurses, allied health team and volunteers in the Palliative Care South East network. I salute you all. You inspire me each and every day, and I thank you for the wonderful commitment and the utilisation of your knowledge and skills for the betterment of our community.